Welcome back. We're discussing the outbreak of the H1N1 flu virus and the way forward for health officials and governments. Joining me to discuss the issue from New Orleans is John Barry, author of The Great Influenza, the epic story of the deadliest plague in history, and an advisor to the World Health Organization officials on influenza, crisis management and risk communication. And from Washington, D.C., Dr. Adel Mahmoud, who is at the Woodrow Wilson School of Public and International Affairs and the Department of Molecular Biology at Princeton University. Now, before we get back to our discussion, let's take a look at the result of that chatroom poll where we asked which best reflects your opinion of the H1N1 flu media coverage. Interestingly enough, 37% of you said it's been overhyped but necessary. 29% said it's been overhyped and caused economic damage. 19% of you said it was adequate for the scale of the problem. And 15% of you said you want more information. Well, let's get back to our discussion. John Barry, your view on how the media has been handling this. Was the media essentially getting a bit too panicked? Was it irresponsible in its coverage of the outbreak of the virus?
Well, honestly, I've been too busy to look at the media coverage. But I will say this. I spent most of last week trying to tamp people's concerns down, saying, look, this doesn't in any way look like it's going to be like 1918, which killed 50 to 100 million people. And right now I find myself tending to say, well, wait a second, this thing's not over yet. It's still a serious threat, and frankly, I think likely to come back in future waves in more explosive form, or at least very possible. I don't know about likely. So,
yeah, well, very interesting this time, though, John, was the use. Well, I was going to say the use of new media here was something unique if you compare it with any other time. The use of the internet, Twitter, SMS text messaging. How do you rate those new media tools as a way for certainly increasing awareness and perhaps containing an outbreak such as this?
Well, it's certainly a very useful tool. The question remains whether or not they're going to become the equivalent of rumor mongering as we used to have, say, 100 years ago when news spread by rumor. Back to 1918, people were saying and convincing each other that it was the Black Plague and not influenza. You know, whether that, obviously that hasn't developed yet this time around. I think that potential is out there. I think it's very important that people get their information from reliable places like the World Health Organization, and therefore I think it's very important that places like WHO retain its credibility, and you retain your credibility by telling the truth. And so far we've had very good transparency from pretty much everybody. You know, I had been critical of Mexico earlier, but I don't think so much they were withholding information. I don't think they were. I think they just had great trouble defining what was going on.
Well, Dr. Mahmoud, that's one thing I want to get your perspective on, is whether or not the authorities were forthcoming enough when it came to reacting quickly enough to this. Even if, as John Barry is saying, there was a good degree of transparency, there was some criticism that the speed of response was a little slow.
Well, because it was difficult in the beginning to assess. I mean, to start with, this is not the season for flu, so we are at the tail end of the seasonal flu. When you come up with a new syndrome, with a new virus infection, it usually takes some time until you determine what is the virus, you get its DNA sequence, and you assess actually the degree of risk. It was important to determine that this is human-to-human transmission, that there was no possibility of transmission from an animal source to humans. I mean, all these things, in effect, I'm not giving excuses, but in effect will take several days to come up to a conclusion. And the world has actually proven that within 2 or 3 weeks, we have sequences, we have DNA sequences of all these virus isolates. We know their origin, we know where they came from. I think this is tremendously important.
In fact, John Barry, that's an interesting point, because you mentioned the flu of 1918 as well a couple of times, and I wonder if that is for anyone to be making, and the media certainly did make the comparison with that outbreak. Is there any realistic comparison to be made when, if you consider there's been nearly 100 years past and advancements in almost every field since then? Is it realistic to compare the two?
I think you need to understand what's going to determine how dangerous a new influenza pandemic is going to be the virus itself, not human intervention. you know, we have certainly made enormous advances from 1918, but the virus is still king. So, as I say, that's the important thing. Now, having said that, I don't think that this virus so far exhibits anything like the tendencies the 1918 had. And in addition, hopefully the fact that this includes some human genes already means that your immune systems are, that you know, it may not be quite as dangerous even if it were to mutate in a more virulent form as 1918, which entered the population as a complete bird virus and then adapted to humans.
Dr. Mahmood, I guess also another issue being discussed here is the economic factor. We see the majority of deaths taking place in Mexico, and of course there is the issue of the economic disparity, countries being able to handle things differently based on their relative wealth level, and also different levels of society being affected. When you look at the way the virus has panned out, how do you see the economic factor being a big decider?
Well, I mean, unfortunately, it started in a middle-income country, but it's also spreading now to all spectrum of economic capabilities. And what is important here is what is the global response. So it's really rewarding to see that WHO is responding by saying we will distribute some of the supplies that were in stocks of the antivirals that can be used for treatment, that we will work together to see how we can expand the manufacturing of new vaccines that will be distributed globally. So in a sense, emerging infections, or particularly a possibility for a pandemic flu, will have a potential for devastating local effects. But it is very, very important that the response has to be global. It is not only Mexico's problem, it's the global problem of influenza today that we all have to be together facing it. And I think the response of WHO to date has been really very, very good.
And if I may
Doctor,
add,
what do you think has been learned? Go ahead, John.
I was just going to say, if you compare this to SARS, the transparency makes a huge difference. China was not transparent at all about SARS, and that led to a significant part of the problem. Whereas Mexico and everyone else so far has been out there from the first second that they've had information.
Well, Doctor, I was going to ask you what lessons you think have been learned from this particular outbreak that might help handle any future similar outbreak in a much better way.
Well, I think there are two lessons which are very, very important. One is the international health regulations, which was approved in 2005 and came into effect in 2007, now obligates every government in this world, if there is an outbreak of a new infection or a syndrome that they are not capable of diagnosing correctly, that they have to inform the international health regulations and the international community through WHO. So in effect, we now have some sort of a global response. The second lesson is emerging infections, whether it is influenza or any other virus or bacteria infections, is a constant feature of nature. It is the struggle between microbes and humans that has been with us since we came to existence and will be with us. And the idea that infectious diseases are a thing of the past and we can move on to think of additional problems is really unreal. I mean, here is the example.
Okay. All right. Well, Dr. Adil Mahmood and John Barry, I want to thank you very much for being on the show. Thanks for giving us your perspective on what's been taking place. Thank you.
You're very welcome. My pleasure.
Thank you. And on the next show, join me from London as we discuss the humanitarian crisis in Sri Lanka. About 50,000 civilians have been displaced by fighting between the army and Tamil Tigers. Red Cross says conditions for thousands of sick and injured and displaced are catastrophic. We'll take a look at the conditions on the ground. Join us for that. From me and the team, thanks for being with us.